Let's take a look at 5 tough questions. Now, when I say tough questions, these are questions that are going to challenge your knowledge clinically. That's our job at Limmer Education. These questions are from our EMT PASS app. We believe that this app gives you the most realistic and the most challenging questions you can find. No one's ever left the National Registry and said, hey, that was easy. As a matter of fact, most people get into their car and say, oh, I think I failed. EMT PASS is going to challenge you. People routinely go for apps that make them feel good. That's not going to help you. You need things that are going to duplicate, that are going to replicate the National Registry. EMT PASS will do that. Let's take a look at these 5 questions. A 19-year-old was stabbed just lateral to the sternum in the left chest about 25 minutes ago and has stopped bleeding. A non-porous dressing was applied and transport began. En route, the patient becomes more short of breath and develops jugular vein distension, JVD. Clear breath sounds are auscultated. The vital signs, pulse 104, respiratory rate of 20, blood pressure is 98/74. The EMT should suspect. All right, now this is a classic National Registry style question. You're given important information. Your job in reading this question is to pick out what's important and help make the right choice. Notice I didn't give you the choices yet. Let's stay focused on the question and figure out what's important, all right? So it's a young patient stabbed just lateral to the sternum in the left chest, right? Off to the side, 25 minutes ago, the bleeding is stopped. A non-porous dressing. Now, don't get freaked out about terms. Non-porous, occlusive dressing, right? You've got a hole in the chest, you've got to seal it. En route, they become more short of breath, right? That's a problem. JVD develops. But clear breath sounds are auscultated, right? That's really the key to this whole question. The vital signs are pulse of 104, 20, 98/74. That's not the smoking gun. You should suspect cardiac tamponade, hemothorax, aortic laceration, or tension pneumothorax. Now, as you look at those choices, if you read that question quickly, you're going to say, whoa, there's a hole in the chest, we sealed it, and now they got bad, that's tension pneumothorax. But did you pay attention to the question? Because there's one thing there, perhaps the most important part of this question, that if you read this too quickly, you're going to get it wrong. That part, clear breath sounds are auscultated. This patient doesn't have a tension pneumothorax. Now, in trauma, when there's distended neck veins, they have obstructed shock. 2 main choices you're going to think about, tension pneumothorax or cardiac tamponade. In this case, cardiac tamponade is a choice. Majority of tamponade cases are caused by stab wounds. But let's look at the others. Hemothorax, no JVD. Maybe flat neck veins, they're bleeding a lot into their pleural space. Aortic laceration, you might as well pull out the bugle. You lacerate the aorta, they're toast. Their blood pressure would be worse. Not a breathing issue, it's a dead issue. What does this come down to? If you read this question well, if you paid attention in class, you're going to eliminate 2 choices, hemothorax and aortic laceration. Those are gone. Tamponade and tension pneumothorax are your 2 choices with JVD. But clear breath sounds rule out tension pneumothorax. Cardiac tamponade is the answer. You have to read the question. There's always 1, maybe 2 things in the question. They're going to hand you the answer. This is legitimate for the street. This is something that you could see, right? No trick question. It's up to you to read the question. Let's go on to number 2. Question number 2. Let's take a look at this one. An unresponsive 6-year-old patient fell from their bicycle, striking their head against a curb. They were wearing a helmet. The helmet was broken in 2, so you got some force there. Their breathing is irregular, and a large hematoma is observed on the top of their head. The EMT should first. All right, so let's think about this question. You got a 6-year-old. Remember, about 10% of your exam is going to be questions about pediatric patients. They fell from their bike, they hit their head, they hit it hard because it split their helmet in two. Their breathing's irregular, got a big hematoma on top of their head. Okay, but they asked the EMT should first assist ventilations with a BVM, bandage the head and apply a cold pack over the bandage, determine if they have adequate alveolar ventilation, or perform a neurologic exam. Well, when it comes to first, and it doesn't appear any care has been done, you should be thinking about your primary assessment, all right? Your primary assessment means you're going to be thinking about airway, breathing, and circulation. Bandaging is not going to be an answer. Determine if they have adequate alveolar ventilation. Okay, maybe. Neurological examination, no. So I've got it down to two choices. Do I assist their ventilations, or do I determine if they have adequate alveolar ventilation? Now, what does alveolar ventilation mean? It means that the air that comes in gets through the dead airspace, 150 mLs in an adult, less than a kid. Air has to get in, fill all those tubes, and get down to the alveoli. Well, ultimately, that would be the reason you ventilate. And while the breathing is irregular, we have no indication of what the volume is and what the rate is, because those are the two things. If you don't have adequate rate and you don't have adequate depth, you have failure and you have to fix it. We know that it's irregular, but what do? ABCs, we just started this. Assist with a BVM or assess them to see if ventilation is necessary. Correct answer, determine if they have adequate alveolar ventilation. All right? Now, let's talk about this briefly. You look at that and you see, determine if they have adequate alveolar ventilation. And you know what your mind's going, blah, 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 right? You're thinking about that. So what does that really mean? It means, are they in failure or not? Because if you don't have adequate alveolar ventilation, getting air to where the gas exchanges, then your patient needs to be ventilated. But just being irregular doesn't tell you whether it's adequate or not, whether the patient's in failure. So the correct answer here is adequate alveolar ventilation. Remember, the correct answer might not be phrased the way you would want it said, but you need to know concepts like alveolar ventilation. And the word adequate should be a clue too. That's saying, are they in failure or not? I'm going to think about that first. That's the correct answer. You've got to do that before you ventilate. Let's go on to question number 3. I don't know if you've been challenged by these so far. If not, that's great. If you are, remember, please lean into this. Consider the advice I'm giving you, how important words are, how important pathophysiology is, because it's going to make a difference here too. So a 37-year-old patient who is unhoused is found unresponsive and has a Glasgow Coma score of 8. Their friends report the patient's been acting funny for the past 2 days, and this morning they were unable to wake the patient. The patient's pupils are unequal. The EMT should suspect. Now, they're asking what you believe this is. Now, every time I talk about diagnosis, people get angry with me. But you know what? You're going to have to figure out what it is. Regardless of what you think about diagnosis, this question says to you, you've got to determine what's wrong with this patient. Let's figure out how to do that. 37-year-old, unhoused, right? And that means they could find themselves more susceptible to certain diseases just because they don't have a home. Glasgow Coma score of 8, pretty dismal, right? That's bad. 8 is a coma. Acting funny for 2 days. All right, they're unable to wake the patient. Pupils are unequal. We have the choice of stroke, opiate overdose, subdural hematoma, or intoxication. Now, that's not a really long question. We've got 1, 2, 3 sentences, and then they ask. But they give you enough information to figure this out if you take the time to do it. Now, what I think as a paramedic and as a clinical person, one of the things that I find the most interesting here is that this occurred over 2 days. They've been acting funny for 2 days. That's a gradual onset. Does a stroke have a gradual onset? No, generally a stroke comes on and something happens. Opiate overdose. Well, that generally, you take the opiate and then you are affected by that. You stop breathing, right? That's the problem with the opiate overdose. That might make meiosis or pinpoint pupils. However, unequal pupils, that doesn't make sense either. Subdural hematoma. Subdural hematoma is a venous bleed. It's a slow bleed. And that means that it can come on over a period of days. So I'm liking that answer. And then intoxication. Okay, getting worse over 2 days, unequal pupils, intoxication. That's also a little bit more acute, right? I don't know if you remember Sesame Street. One of these things is not like the other. Subdural hematoma is the one thing here that comes on more gradually. Now, in the elderly and people who drink a lot, the brain actually atrophies and shrinks. There are bridging veins that go from the skull right down to the brain. And when someone falls, right, which may happen in this unhoused person, they hit their head. It causes slow venous bleeding. That blood starts accumulating and starts squishing the brain. And it can happen over a period of days slowly. Unequal pupils, coma, Glasgow Coma Score of 8, they're unresponsive. Like I said, that gradual onset, subdural hematoma is the only one that fits here. Did you get that? Now, you may say unequal pupils, head injury, and go right to subdural hematoma, but the National Registry always gives you things that are choosable, right? Could a stroke do that if it's a bleed? Well, maybe, but that happens quickly. So as you go through, I want you to think about these questions like I'm teaching you here. Correct answer here, subdural hematoma. Question number 4. The National Registry test has changed. There's different question types. It's important that we give you exposure to those. This is a multiple response question. Multiple response questions on the National Registry exam, there's a few things you need to know. The first is that there'll always be 3 incorrect answers. You will choose 2 of 5 or 3 of 6. Now, the bad news is that there's no partial credit. The National Registry says there's only 2 or 3 correct answers. And if you choose the wrong answer, you're out. So you've got to really think about these. So let's take a look at this question. This is multiple response. We're going to ask you to choose 3. A disoriented 56-year-old patient has had progressive weakness over 3 days. The patient weighs 240 pounds, appears very sick, and has a fruity smell on their breath. Which of the following findings should the EMT expect to be present? Select the 3 answer options which are correct. All right, so read the question carefully. You're going to have to choose 3. Now, the good news on the National Registry, if you only choose 2, they won't let you move ahead. You've got to choose 3. And the question won't let you choose 4. So there's a little bit of some guardrails built in there. So I like to read the question twice when I take the National Registry. I take it every couple of years. So let's go back to the question. Disoriented, 56. See, when you look at these questions, think about the age. If the patient was sitting in front of you, you'd know how old they are, right? Age does make a difference when you're thinking about conditions. Progressive weakness over 3 days. Patient weighs 240, appears very sick, has a fruity smell on their breath, right? That fruity smell on their breath should be a clue. Which of the following should the EMT expect to be present? So as you do this, we have a gradual onset and a fruity smell on their breath. That fruity, sometimes described as an acetone breath, says diabetic ketoacidosis, right? This is common in type 1 insulin-dependent diabetics who have no insulin. Their bodies had to now digest fats and proteins. And doing that creates acid, and that creates problems. So let's look at the choices and see what's going on. 3 answer options which are correct. Sweating, rapid onset of coma, excessive hunger, cool clammy skin, excessive thirst, and deep frequent respirations. All right, let's cut right to the chase. What this is asking you here with these 6 choices, 3 of these choices have to do with hypoglycemia. That's not this patient's problem. But 3 of them have to do with hyperglycemia, specifically diabetic ketoacidosis. Hypoglycemia, low blood glucose, comes on quickly. The skin is cool and moist as you do this, and that, again, rapid, it comes on quickly. So sweating, cool, clammy skin, and rapid onset of coma are three that you should rule out. Remember, there's two ways to get a question right. You may know the answers. That's great. Or you may know three of them aren't the answer, and that leaves three. It doesn't matter how you do it. Just get the question right. That's the way these things work. So if you know hypoglycemia, sweaty skin, rapid onset, you can rule out three things. But diabetic ketoacidosis, excessive hunger, right? Polyphagia, excessive thirst, polydipsia, and deep, frequent respirations, known as Kussmaul's breathing. That occurs in acidosis. The body wants to blow off some CO2. Not the most efficient way to get rid of acidosis, but it's part of the solution. That's called Kussmaul's breathing. So Kussmaul's breathing, deep, frequent respirations, excessive thirst, and excessive hunger all go with hyperglycemia, and deep, frequent respiration specifically goes with diabetic ketoacidosis. What do you need to know this question? How do you get the answers? You've got to spend some time knowing the difference between hypoglycemia and hyperglycemia. Pathophysiology can help you as well. The rapid, deep breathing, Kussmaul's, that'll point you in the right direction. But hypoglycemia, the body uses the sympathetic nervous system to liberate some glycogen, some stored sugar. But what happens when the sympathetic nervous system kicks in, our fight or flight? It takes blood away from our periphery. Our skin becomes cool, pale, and moist. In the old days, hypoglycemia used to be called insulin shock. Why? Because it looks like the patient's in shock. If you understand, see, everyone says, how do I memorize all these signs and symptoms? I say go deeper. I hope your class taught you pathophysiology. That's understanding what goes on beneath the skin and helps you understand and get questions like this correct. Your fifth and last question, here we go. This is the second type of question you may see on the exam. These are called TEIs, or Technology Enhanced Items. In this case, you're going to drag and drop. Now, let me first say, if you're nervous about these questions, don't be nervous about the dragging and dropping. You know how to do that. You probably do it already. Focus on the right things. Focus on knowing the clinical content. Clicking and dragging and dropping is the easy part. Understanding is a more challenging part. Let's look at this question. 28-year-old patient is unresponsive. They were found in a driveway in a suburban neighborhood. A person walking a dog found the patient and called EMS. Vital signs are pulse of 96, respiratory rate is 16, and the blood pressure is 118 on 64. Patient satting at 95% and has cool, moist skin. What this question asks you to do is choose the condition that you should suspect and then choose the most appropriate treatment for that condition. Now, I love these questions. This is the clinical question. This is what you should embrace as an EMT, and you should be able to say, hey, I can figure this out, or want to at least strive to figure these things out, because these are the decisions you'll need to make on the street. These are good questions. They're fair game. So what are the conditions? Opioid overdose, hypoglycemia, and obstructive shock. Let's start with that, because if you choose the wrong condition, you're probably going to choose the wrong treatment. But when you look at those, you may have an initial answer. You may think about something and say, oh, young person found in a driveway, that's probably an opioid overdose, right? Think about it. Opioid overdose, what are we going to see? We're going to see hypoventilation. The respiratory rate is 16, and they're satting at 95%. Is that an opioid overdose? No. Why? They're breathing too fast, their sats are too high. Everything you need to answer these questions is there if you take the time and think. Hypoglycemia. All right, vital signs, pulse is a little fast, blood pressure's good, SAT is good, but cool, moist skin. We know that happens in hypoglycemia. They're unresponsive. But that's a possibility. Let's look at the other choice. Don't just pick one. Look at all the choices. Obstructive shock. Okay, let's look at this. Their pulse is 96, but are they really in shock? The blood pressure is 118/64. Now, this is a 28-year-old. That's a great blood pressure. And the pulse pressure is really wide. If that pulse of 96 was compensating for shock, that pulse pressure would be more narrow. You'd see 108/82 or something, where that difference between the systolic and diastolic comes together. There's nothing in this question that indicates shock, except cool, moist skin. But look at the blood pressure. Do we see anything? Remember, obstructive shock. Anything about distended neck veins? Nothing. No indications of trauma. I'm leaning against obstructive shock. Unresponsive, cool, moist skin, relatively young person with no signs of opioid overdose, no signs of obstructive shock. I'm going with hypoglycemia. Did you use that same process? Did you see how every answer you need is in the question and everything that you don't see there isn't there, like JVD? So if I have hypoglycemia, what are my treatments? Administer oral glucose. Don't fall for that. Why? Because the patient is unresponsive. We can't give oral glucose if the patient is unresponsive. You go with hypoglycemia, you try and hit the easy button and go for glucose, you miss that part of the question. The patient's unresponsive. Transport and monitor their airway. I like that. Administer naloxone. No, it's not an opioid overdose. Correct answer? Transport and monitor their airway. So, correct condition, hypoglycemia, transport and monitor their airway. That's how you answer these questions successfully. These questions are very realistic compared to what you'll see on the National Registry. At Limmer Education, we work really, really hard to give you those things. A couple things I want to tell you, and by the way, these are from our EMT PASS app. You can trust it to give you not only questions you'll see on the National Registry, but things that'll make you think clinically to be able to become a better EMT in doing that. Remember that the National Registry is not going to trick you. We're not going to trick you in these questions. We're just going to give you good, solid clinical questions, things that you'll see on the exam, things that are relevant in the field. That's our job at Limmer Education, is to help you pass that test. EMT PASS is one of our products that will help get you there.